A House committee advances hospital transparency legislation. The Department of Education expands their list of professional degrees. And the Centers for Disease Control and Prevention posts a new charter for their Vaccine Advisory Committee. For the week of July 6th, 2026, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Thank you, Mr. Speaker, and I want to thank our Chairman Smith for his incredible leadership over the years. I rise in strong support of my bill, the Healthcare Efficiency Through Flexibility Act, which helps minimize burdens on value-based care organizations. We must move away from fee-for-service.
Kicking off this week's episode with news from Capitol Hill, where the House of Representatives passed the Healthcare Efficiency Through Flexibility Act by voice vote on Monday. The bipartisan legislation, introduced by Representative Vern Buchanan, a Republican from Florida, would permit a wide variety of quality measure reporting methods for accountable care organizations through 2029, including the currently in place electronic clinical quality measures. The bill also clarifies data completeness requirements and creates a digital quality measure pilot program.
Proud to be an original co-sponsor because I think this is an important bill in the context of the special status that we grant nonprofits, which we've done for a long time from the IRS code, from the tax code. We grant nonprofit status and forgiveness on taxes in exchange for a public benefit provided by that organization.
The House Ways and Means Committee advanced the Tax-Exempt Hospital Transparency Act on Wednesday. The legislation, sponsored by Representative Greg Murphy, a Republican physician from North Carolina, would require tax-exempt hospitals to report more details on income, charity care expenditures, advertising, community benefits, and quality improvement. Consideration of the bill by the committee was previously delayed due to pushback from the hospital industry. The Senate Health, Education, Labor, and Pensions, or HELP Committee, is expected to hold confirmation hearings for the Centers for Disease Control and Prevention Director nominee Erica Schwartz and Surgeon General nominee Nicole Saphier sometime this month, according to a committee spokesperson. HELP Committee Chairman Bill Cassidy, a Republican physician from Louisiana, has expressed support for both nominees, who are considered more conventional picks than some of the Trump administration's prior candidates for the positions. Dr. Schwartz's required ethics and financial disclosure paperwork have already been posted by the Office of Government Ethics, while Dr. Saphier's are not yet available.
I think that's the point. I think we sent letters to 5 different major companies who are all doing major billion-dollar deals and trials with China, phase 1 trials for new medicines. And the reason they're doing that is because it's cheaper to do there. And I applaud the Trump administration's initiative.
The House Select Committee on China has written Pfizer, AbbVie, Merck, Eli Lilly, and Bristol Myers Squibb regarding clinical trials being conducted in China. The panel's chairman, John Molinar, a Republican from Michigan, requests information on company standards for the conduct of such clinical trials, data on the number of trials conducted in China, details on the due diligence process for protecting IP and sensitive data, and a list of all licensing, equity, or joint venture deals with Chinese biotechnology companies. Responses to the letters are requested no later than July 17th. Shifting to news from the administration, where the Department of Education has announced a new list of degrees that qualify as professional degrees under the One Big Beautiful Bill Act's new caps on borrowing limits for graduate and professional degree programs. The original rule, which was recently blocked by a federal judge for violating the Administrative Procedure Act, included just 11 professional degrees, excluding certain graduate-level clinical programs, such as nursing, physician assistant, occupational therapy, and physical therapy. The new definition includes 29 fields. The administration has clarified that the expanded list is intended only to facilitate implementation of the court's order, but may change as litigation proceeds. Under the One Big Beautiful Bill Act caps, students pursuing professional degrees can borrow up to $50,000 a year and $200,000 total, while those in graduate programs can borrow up to $20,500 annually and $100,000 total. The new caps went into effect on July 1st. Winding down today, where the Centers for Disease Control and Prevention recently posted a new charter for the Advisory Committee on Immunization Practices, or ACIP. The document broadens the qualifications for individuals to serve on the panel, stating that members should, quote, represent a balanced range of scientific, clinical, and public health expertise relevant to the committee's mission, unquote. It would also delegate management and support of ACIP from the National Center for Immunization and Respiratory Diseases to the CDC Office of the Chief of Staff and the CDC Director, as well as modify the composition of the committee's liaison membership. A federal judge recently blocked U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr.'s attempt to reconstitute ACIP with his own member selections. Some critics have characterized the new charter as an attempt to sidestep the court ruling.
I want to congratulate Maylot Kiros for her victory last night, and I want to wish her all the best in her future. I also want to thank Wanda James for her years of involvement and service to this community. Thanks to all my friends and supporters who have lifted me up in all of my years in public service. And thanks to
Final news today, where Representative Diana DeGette, a Democrat from Colorado who you just heard, was defeated in the Colorado Democratic primary for the state's 1st congressional district last week. DeGette was first elected to the House of Representatives in 1996. She currently serves as ranking member of the Energy and Commerce Subcommittee on Health and a co-chair of the House Diabetes Caucus. DeGette was an original author of the 2016 landmark law, the 21st Century Cures Act, and has been a champion of progressive health causes, supporting Medicare for all and access to abortion during her time in Congress. She conceded the race to Democratic Socialist Maylot Kiros.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Help Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with a call to order, where we lightning around congressional meetings and hearings in the near future that you need to know about. The first and only event currently on the calendar will occur on Wednesday, July 15th at 2:30 p.m., when the Senate Armed Services Subcommittee on Personnel holds a hearing to receive testimony on the TRICARE Pharmacy Program. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.